Hi everyone, good morning. I have a patient that hasn't turned up, so I thought to take a moment to kind of jump on here and just ramble again. That's what I'm good for. So there's a couple of things I wanted to talk about. Some of you may or may not have heard of a medication, prescription medication called Roaccutane or Accutane or tretinoin or oral tretinoin. There's quite a lot of different names for it, but the actual brand name is actually Roaccutane. And this is a medication that is prescribed for patients that have quite severe, moderate to severe acne, particularly those with cystic acne, pustules, and very, very inflamed and angry acne. So there'll be a lot of patients that will be prescribed this medication for either acne on the face, acne anywhere else in the body. It's a normal prescription to receive. Now, the biggest issue that or the biggest concern I have with this medication is that first of all, it works really, really well. So it's not a I'm not questioning its efficacy or the way that it works, or even the outcome. It works really, really well. The issue I've got is the journey. So any patient that are actually taking this medication or have been offered this prescription, it's really important to consider all of the factors. So the first thing to really be aware of is that Roaccutane contains a very strong retinoid compound, shall we say, and it can disrupt a lot of systemic systems. So in terms of, there have been studies to show that it can affect mental status, it can affect your mental health. So it can make you feel a little bit low, depression, there's a lot of mental health issues that can be associated with this medication. So that's one thing. I mean, I'm not going to delve too much into that, but that's one thing that you really need to be questioning the GP or the dermatologist that's prescribing you this. What are the risks? What are the balances? What can I do to avoid any of these situations? And do you think that this is a risk worth taking? That's the first thing I would say. The second thing is that tretinoin or Roaccutane can really make your skin quite sensitive. Now, there's two issues with this. One is obviously symptomatic sensitivity, which means that touching your skin, different changes, temperatures for water, changes in weather, that can really, really aggravate your skin. So the next thing you need to be asking your GP or dermatologist is, right, so what am I going to do if that does actually happen? How do I desensitize my skin? So in terms of, we're looking at skincare, moisturizers, lifestyle and habits that you should be avoiding, specifically when you are using this product. So the first thing I would say is that you are not to use too many strong active ingredient skincare. So it's to make sure that you are not triggering too many issues. And on top of that, what we really have to make sure we're doing is that you are using sunscreen, because your skin is even more sensitive. It's photosensitive to the UV radiation from the sun. What that means is you can get irritation, obviously redness, tenderness, but more importantly, your skin will react to this trauma in the form of acne, hyperpigmentation, rosacea. It can really trigger a lot of conditions. So it's really important that you are not traumatizing the skin with active, strong, high concentration active ingredient, and you are protecting your skin from the UV radiation with regular, consistent sunscreen. It's really, really important this is considered. Now, the issue I am having is that a lot of patients are being prescribed Roaccutane without having any discussion about mental health, without any discussion about your skincare regime at all, and not even discussing the significant requirement for the use of sunscreen. So I've had a patient that was talking to me yesterday and said, "Oh, I'm not coming in for treatment because I'm currently on Roaccutane. I've just been prescribed Roaccutane." That's okay. So what exactly was the conversation you had? And in that conversation, none of these 3 points came up. It's really important that you actually know that these are the questions to flag up, and obviously really question it if your professional is not actually telling you about these concerns, because they can really cause you long-term damage. Yeah, acne might go, great, but then you're left with the scarring and the pigmentation to deal with, which can be quite stubborn. So it's really, really important that you actually are questioning these things. And one major point is that I will not do any treatment on anyone who is taking Roaccutane, and I will wait a period of 6 months until you finish that prescription. The reason for it is because Roaccutane can actually alter the skin's ability to heal. And so I will have a very unpredictable journey if I was to implement any treatments for you. So I would rather not. I would rather not go through that journey whereby I have no idea how your skin's going to react. So I don't treat patients who are taking Roaccutane or have not been off it for long enough, in the sense of I wait 6 months. So it's really important that you are aware of these things. I don't think there's enough awareness out there, but question the professional. If you're not sure, question the professional. There's no harm. You have a full right to do that. And if you feel the professional isn't quite sure, back away. Back away, because a good professional should, first of all, either know the answer to the question, especially if they're prescribing something to you, but if they don't know, then they would hold off and seek a second opinion before they prescribe it to you. So really be careful about who you're trusting with your skin, but also what steps you're taking, okay? That was a little bit of a longer ramble, but I hope that was informative, and obviously any questions, let me know.